Okay, so welcome again to back to the next deep dive session 2A, which is on smart living. So now we have our three speakers and we have our moderator as well for this session already joining us in this session. So in these talks, as we know, are going to discuss further on what health data exists in Jakarta and what are the use cases and the current problems. So for that matter, I would like pass on the word to our moderator for this session, Mike Richardson, as a founder and partner of Photonics Insights GmbH. And good morning to Germany, and I hope everything is well there.
Hello, Mira, and thank you very much for the warm introduction. Terima kasih. We're excited to have this amazing panel today. Please allow me to introduce our wonderful panelists. I would like to start with Alina Saptati. Please help me with my pronunciation if I have any problems. Elena is a grassroots activist who has created a data but this page, this data source that she has is amazing. I was browsing it last night, translating it into English, and learned a lot about the state of COVID in Jakarta because of this. Then we will have Dr. Very, a master in public policy, who is helping drive public policy in response to healthcare and COVID in Indonesia. And then lastly, we will have Dr. Supachai, implementation professor at FIBO in Bangkok. He develops medical robots. So what we have here is we have grassroots combined with public policy and implementation. And we'd like to start with Alina, please.
Thank you, Mike, for the introduction, and a very good evening to the panelists, the other panelists, and a good morning to you, Mike. And I'm going to start my screen. So, okay, is everybody seeing my presentation?
Not yet.
Not yet.
What about now?
Let's see. Well, while we're waiting, okay, perfect. Here we go.
Yep. Right.
Okay. So what we do at Kawal COVID-19, we only started on the 1st of March, and we're actually not healthcare specialists. We are just a group of people who love data and love analyzing it to bits and the bits and pieces of it. And so we actually started in 2014 as a group that did a parallel count of presidential election in Indonesia, and that's how we started as a pro data group, and then ended after the election, and then we regrouped after 5 years. So, but we became friends. We became really, really close friends that worked virtually because we come from all over the world, but we're all Indonesian. And in January, when we first heard about the NCOV 2019, it wasn't even called COVID back then. We started analyzing the data because we noticed that the Chinese CDC actually revealed the data of infection and where it came from, where it's originating, and how it spread and things like that. So we actually went into the CDC China page and we Google Translate what's in there, and we started discussing it because this was something really new and the data was available for us to analyze. And what started as a group discussion among friends just to educate ourselves, we started following trends from what happened in China and how it then spread to Wuhan, to different parts of China, and then how COVID then made its way to Italy and Germany and Thailand, Taiwan, Vietnam, Singapore, Malaysia, what have you. We started analyzing them, trying to figure out patterns and what governments did quickly and where governments were on the slow side of policy making. And from there, there's this wealth of information about how it spread, just starting from analyzing data. So So on the 1st of March, we decided to start sharing this information with the people in Indonesia so that, kind of people in Indonesia could start educating themselves for the eventuality of COVID-19 coming into Indonesia. And of course, when we started on the 1st of March, little did we know that the next day was going to be the announcement of the first 2 cases. We thought we would have a couple of weeks to prepare, and we did not. We basically, overnight, we had nothing, and then we had to quickly put up content, the result of our discussion, kind of put it together quickly, kind of had, medical experts sort of like reviewed it. And that's how we started. And it's been 9 months now, and we're still going. And it's a loose netizen group. We're not even a legal organization, but we have the same passion, and we want data to be used for better health decision or better decision making, better policy making going forward. And we want to challenge governments to equip citizens with decision making tools. So a few examples that these are apps that I use almost on daily basis. So a lot of people, they use Waze or Google Map or Apple Map to make decision about commuting, when to commute, and routing decision. And the middle one is kind of air visual. And I use that to make decision as to when to go out jogging, when to go out for a walk, and when it is not a good idea to be outdoors, for example, just based on air pollution level. Weather app, a lot of people use that. Is it a good time to go to the beach, or is it a good time to kind of do an outdoor party, go out boating, or whatsoever? Kind of, is it a good time to go swimming? So data, when visualized well, helps everyday people make better decisions. And another example here is a self-diagnostic tools that people can do on their mobile phone. How high is your risk of exposure to COVID, and how do you deal with it at home, and at what point do you need to contact medical expert? So data, when visualized well, it helps everyday people make better decisions. And this is what we're hoping for Indonesia. And then coming back to COVID-19, how does it look like in Indonesia? And here I'm talking about Indonesia in general, not just Jakarta, but feel free to ask us. We have Dr. Ferry as well about COVID-19 status in Jakarta. So in Indonesia, in general, data is incomplete. So what you are seeing on the screen is a spreadsheet of the data points that we collect from provincial and city level websites across Indonesia. We do this every day. And if you see, there are a lot of empty cells. There are a lot of empty cells here because some provinces do not give like testing data. Some of them do not put out kind of number of people who are suspect or contact traced. And because of that, we can do very limited analysis on the status of the pandemic in their area. Jakarta and probably West Sumatra are ahead in this game. We have the data on just about everything from these 2 provinces, and kudos to them in that area. So at least, from the data as is, we can analyze the mortality rate, excess deaths, kind of testing rate, positivity rate. And from that, we as people who know how to crunch this number, I can tell my family back in Jakarta about the risk of going out, kind of the risk that you are putting yourself into when you go out. These are the precautions that you need to take, things like that. But, kind of, we want to go beyond just being able to inform our friends and family. We're hoping that this data become uniform. There's one way to input And there's one way that people see this data, because currently these data are presented very differently in different websites. Essentially, they're all mentioning the same numbers, the same data points, but the way it's presented is very, very different. So that, for example, if I live in Jakarta and then I need to travel to Bali, or I need to travel to North Sumatra, and I want to look for the COVID status in that province, the challenge becomes, I need to learn where to look for the data, and how it's presented. So it's like learning how the data is visualized all over again. And then with every travel that I need to make, that learning point repeats. Also, what we have found out is that because we curate data from the central government and then from the provincial websites and also the city level websites across Indonesia, what we find is that the data doesn't tally. The number doesn't tally in a number of provinces, especially the deaths, the mortality, the mortality data. So you see here, there's a 16% gap between what the central government announced versus, the compilation of the provincial numbers. So with the reality like that, especially with this one, when the data is presented differently, when they're all actually speaking about the same numbers, what do we actually need? And I'm talking here from a user perspective, because we're not policymakers. So this is a wish list of, kind of things that will really help us as citizens make informed decisions about our day. One is a real-time data on clusters and highest risk activities. So if there is an outbreak, whether it be at school or at a religious facility or in a supermarket or a wet market somewhere, shopping mall, what have you, that basically we can see that. So we know the type of activities that we need to avoid to prevent us from being exposed. So what are the highest risk activities? Where are the clusters? Those are really, really useful data to visualize. So that's first and foremost. The second one is find available hospital. And this becomes a point of contention, a point of confusion as well for a lot of people, because some people say that hospitals are full. Some of them say, but there are still beds, but not ICU beds, but not isolation beds. So, and there's not one centralized information center where we can find bed occupancy rate or hospital occupancy rate that is real time. So that will be really useful, so that, at time of emergency, you can go to an app, or you can go to a website, or you can go to a hotline, and they have the data right in front of them, kind of where can you find a bed. And then who to contact in medical emergency. Is it the community hospital, the family doctor, the hospital? It's like an address book in times of emergency, where they can just pick and choose, okay, I want to put this in my phone book, or they can manually put in, kind of, these are my emergency contacts. Commuting and contact journal. I live in Singapore, and in Singapore, there's a QR code system for checking in and checking out from any place that I visit outside of my own home. And in Indonesia, because of, kind of between the internet, internet is not yet ubiquitous, probably something like that is harder to roll out. But if we make it available on an app or something, where people can manually put in their commuting and contact journal, and then put it in an app, and then they can just pull it out if they get sick and needs to be contact traced. Another set of data that will be very important to be visualized will be COVID cases in your vicinity. So we have data from at provincial level, and then we have data at the city level. And some of them have data gaps, some of them have data delays, so they're not even real time. So we need the data to be real time to be useful. And then, kind of wherever we go, if we can go to the app and then the app detects where our location is, and then it tells us the COVID cases in our vicinity at any given point, that will be awesome, because that tells us the risk that we are exposing ourselves to by being in that area. And that way we can probably plan better the next time, or we can take more precautions. So these are just 5 data from a user perspective, things that will really help inform and empower people to make, wiser decision about their daily activities. And I want to close with just this quote. And when government puts responsibilities into the hands of the people, it puts responsibility on its shoulders to give them tools to succeed. If we are sending people to war, we need to equip them with weapons, with defense mechanism, with this kind of this armor, with this bulletproof vest and helmet and what have you, and also rations. And the same principle applies here. A lot of responsibility are put into the hands of the people to follow protocols, to keep a safe distance, to wear masks, stay at home, work from home, things like that. But at the same time, there are people who cannot just stay at home because they need to be on the road to work. So we need to give these people the tools to succeed. And the 5 things that are on our wish list, those will be really, really helpful for the people who have no choice but to continue certain activities. And hopefully that's a good opening to our discussion in the next hour. Thank you, Mike.
Oh, Alina, this was a wonderful presentation, and thank you. And I think this really segues well into Dr. Very, because you gave us a primer on citizen data action, right? How citizens can come together, loosely organized, and deliver positive outcomes by looking at publicly available data. And you've also given us a call to action, a wish list. And so this segues into Dr. Very. So now we're going from grassroots into the public policy arena. So Dr. Very, how are you doing today?
I'm very good, Mike. Thank you.
So we're looking forward to your presentation. Before you start your presentation, are there any introductory thoughts that you would like to share, especially based on what Alina has shared with us?
Yeah, they're very, very interesting presentation from Miss Elena. Yeah, that's something that is, what can I say, honest way to tell us. So, thank you for Miss Elena for challenging the government. So yeah, but there are some things that maybe in my presentation I will also respond to some of the things that Miss Elena said. It's not a debate, but it's something that maybe, yeah, maybe many of government activities sometimes uh, are not really well published. So maybe some citizens not yet already hear or experience about the things that we already serve. So yeah, thank you for giving this opportunity. So hopefully from this presentation, I can share some of the things that we already did. So yeah, things like what Miss Elena said will be answered, and hopefully this will bring a positive impact for the next for the next future, something like that, Mike. Thank you.
Oh, well, we're looking forward to this, Dr. Very. It's really great when you get a call to action and then someone who is actually able to act upon that call. So we're looking forward to your presentation.
Okay. Can I start it now, Mike?
Yes, please.
Okay. Please allow me to share screen. Oh, something wrong here. Sorry.
I think it's the arrow pointing up down in your window in the view you have. If we
Yeah.
have anyone, yeah, if we have anyone from tech support, can we message Dr. Vary and also prepare Dr. Supicha? Let's see.
Uh,
So while we're waiting for this, and Dr. Vary is configuring this presentation, as we know, we have challenges with these online events since COVID, and it's how we work with it. I'm really interested. What I want to show, let me show something. If anyone's looking at the screen, oh, perfect. This is the application. We put the URL in the chat. I really urge people to check out what Alina has created here. Thank you, Dr. Vary. We're looking forward to this.
okay. Can everyone see the presentation now on the screen?
Yes.
Okay, thank you. First of all, I would like to say thank you and good evening to everyone. Thank you for the Smart Change Conference 2020 Urban Data Committee for inviting us here. So, in the next 10 minutes, I will try to explain the perspective of the Jakarta Department of Health in digital health transformation, what has been and will be done in the future. I will divide the presentation into four parts, which are the forward, then the major activities, talking about the current and potential implementation towards achieving the SDGs and controlling the COVID-19. And then we're also going to share a little bit about our blueprint design. And of course, for the closing, we have the conclusion. Digital transformation in health service already happen all over the world, including in Jakarta. The presence of health technology has changed human behavior, and the COVID-19 pandemic has accelerated these changes. The ease of collecting, analyzing, and visualizing data with the help of technology has impact in the formulation of public policies. Here are some of the keynotes in digital transformation in health services. Uh, First, when we think of on-demand, we think of citizens who want things at their own convenience, on their own time, and wherever they happen to be. The health service is entering the era of digital innovations as patients seek on-demand health service because of their busy schedules. Technology is also expected to able to provide valid big data, which will then be used to formulate public policy. Big data analysis could identify people, situation, condition, and create preventive plans, especially for communicable and non-communicable disease. Chatbots and virtual health assistants are another AI-based technology that patients are becoming familiar with. Chatbots can fill a multitude of roles, from customer service representative to screening tools. In recent years, Jakarta has implemented digital health technology to assist and facilitate the tasks of health workers. At first, the technology built was still related to recording and reporting, but over time, many applications were developed for specific purposes in order to achieve health program targets, especially the SDGs target. Of the 17 SDGs target, 4 of them are related to the health sector. They are target number 2, 3, 5, and 6. And here are some of the applications that we have developed to support the achievement of the SDGs target. First, here I will talk a little bit about the JACTRACK application. Is a web-based online application system containing information data and innovative activity reports to support the acceleration of HIV and AIDS response through Jakarta's Fast Track program. Various features are available, including service reservations, reports, fast monitoring, partner notification, etc. And then here we have the early warning of dengue hemorrhagic fever. This website provides a prediction of the incidence of dengue fever for the next 3 months and a prediction of the air humidity or relative humidity for the next 5 months. From this website, we can get information that the higher the probability, the higher the RH or relative humidity will support the Aedes aegypti growth, so which then increase the population infected with dengue hemorrhagic fever. So when you open this website, you can see like this map. So hopefully the people who is in charge, the officers who is in charge at those environment or on those region, and also for the citizens who stay in those area can have like a early warning, so they can like preparing that you should do something or make sure that your environment is clean so the prediction won't happen. And then we also already implemented the teleconsultation between doctors in primary care center with the OBGYN at the referral hospitals using the tele ultrasonography technology. We also have the immunization recording system for children and mothers. And not to forget, we also have some application that can use for screening. Here I make samples for the mental health screening using the eJiwa application and screening for elementary school students. Regarding the controlling of COVID-19 in Jakarta, the Jakarta Department of Health has developed many applications, either develop it alone or in collaboration with other collaborators. The development is focused on supporting the COVID-19 control strategy known as 3T, which is testing, tracing, and treatment. And here are some of the applications. Regarding testing, Jakarta help provide a Jakarta COVID-19 recording and reporting system that can be accessed by all health facilities, including the COVID-19 specimen examination lab, which is also has been integrated with the National Laboratory Result Recording System. This system can also be used for people or for citizens who want to know the result of my lab examination with just your mobile or with your laptop. So you don't have to come to the laboratorium. You can just check it with the feature in this application. And then we work together with the Ministry of Health uh, to implement a Silacak application that help health officers tracing every positive COVID-19 patient close contact. So yeah, previously we discussed in the backstage about the challenge of doing tracing. Yeah, but this is one of our way to do that. Well, we won't give up. Tracing is something that we should do and we must do. So there's no give up option for this, although it's very challenging. And then we also have this one, this self isolation monitoring. Uh, with various features such as attendance report using your face. If it's not your face, with face recognition. So if it's not your face, so the application will notify the health officers in health center that this patient is not reporting about his about his or her location. And then we have this tracking movement, so we know if that person is get outside of his or her isolation location. And then the application also has these consultation features, so the patient can talk and consult with the health officers. And we also provide the dashboard. Utilizing chatbot technology is also done by us. We use the chatbot technology to assist officers at the command center in serving complaints and questions from the citizens regarding COVID-19. And here, like I said before, that Ms. Elena mentioned about the bed management system. Actually, Jakarta already has this hospital bed management system for specific for COVID-19. We have 192 hospitals in Jakarta, both government and private. 115 hospitals already integrated with the system. There are some hospitals that is still need to be integrated. And then we also, together with researchers and organizations, we make use of the data that has been collected for research and publications. It is hoped that the result of this research can be useful not only for the community, but also for researchers and other policymakers. Here, a glimpse of our vision of our work plan. This is our dreams to do. And right now, we are focused on providing this one, the API gateway, and this one, the health data warehouse using the DHIS2 platform. Uh, yeah, while still performing to continuing tidy up, streamline, and integrate the various existing system and application, because it's like a application jungle here, right? Because many hospitals, many health facilities develop their own systems, their own application with different things. So it's hard to integrate it all those things. So yeah, I call it application jungle. So this is one of our challenge to tidy it up and integrate it into our super app. So Jakarta right now is developing its super app. We call it Jak Sehat or Jak Health. Slowly but surely in the future, all health application will be integrated in this super app. The Jak Sehat is a digital health super app. It's a hub for various official application of Jakarta Department of Health to facilitate and improve health services for the citizens of Jakarta. It acts as a launcher and web viewer, also aims to optimize the performance of the Jakarta Department of Health staff with various available internal applications. For the conclusion, digital transformation is a health service. Digital transformation in health service is the positive impact of technology in health service. But deciding which emerging technologies are worth investing in and getting on the team on board with the change is often the hardest part. Innovation main goals are to improve patient outcomes and public satisfaction, reducing human error, streamlining physicians' work, optimizing system, lowering costs, and of course, producing and utilizing big data. Jakarta Department of Health are very open to cooperation opportunities, both in terms of developing a health information system in Jakarta, as well as research collaboration. I guess that's all, Mike. Thank you.
Well, Dr. Very, this was very informative, and it looks like we already have points where we can start the collaboration with Alina in exposing the API data. So right now, Dr. Supachai will be preparing his slides because now we're going to be looking at more of an implementation. We have ideas with data, and Dr. Supachai, if we think of data as the mind, Dr. Supachai is going to provide examples of the hands, the way we interact with the real world. Dr. Very, I'm sure that you will be carrying on this conversation with Alina because it sounds like this is wonderful. You already have system diagrams. This is what data geeks like me love to see, that it's plugging in APIs. So it looks like you're very well advanced and moving forward with delivery. Alina, what did you take from Dr. Very's, what he shared? I was thinking about the bed count, because he mentioned that, and you mentioned that was a pressing issue to estimate bed availability.
Yes, very good to know that it's there, it's available, and because the issue that we encountered earlier was, to have people kind of messaging us on social media saying that they couldn't get a bed, and then we didn't know where that they could look for this information in the Jak Sehat app. So I was kind of browsing through the Jaki app last night, and so I was trying to find something like that, but I couldn't find it there. So it's good to know that it's there. It's definitely something that is useful. I see that there were also some data viz about contact tracing and clusters. I did see it on the website version earlier, but I haven't checked that lately. So that's another kind of like check mark. It's like, yay, another wish fulfilled.
Yeah, maybe
Sometimes
we can join for like helping us to public
Sure. Yes.
public it, like because the government have a strict rules for like publish things, or maybe you as like a grassroots organization, you are very free to use your own language or your own style, so you can get more closer to the citizens. So maybe something we can cooperate with publishing things that we have been done. Thank you.
Sure. Thank you.
Excellent. Thank you so much. Let's follow through with that. And now, Dr. Supachai, are you ready to show the wonders of FIBO robotics and all of the beautiful technology you're developing in Bangkok?
All right. Can you see my screen? I'm sharing now.
I can't see it yet. Perfect. It's coming up right now.
All right. Okay. Good evening, everyone. My name is Supachai Wongpunjong from Institute of Robotics in King Mongkut University of Technology, Thailand. And today I'm going to talk in the topic of robotics and AI for healthcare in Thailand. And hopefully this technology going to help not just only Thailand, but for sure other countries that we're going to use this technology to work through. And firstly, thank you, Mike, for great moderations of these sessions, and other two speakers that wonderful works on data. And for me, well, actually, firstly, FIBO is Institute of Robotics, and we work with a lot of robotics and automations in the field of manufacturing and also the healthcare. And I also started the research center. It's called Hospital Automation Center. And actually, this became at the same time as a COVID-19 attack our society. So I think the technology that we already developed for more than 4 or 5 years, it will be fit somehow to help us in COVID-19 pandemic situations. So the technology overview, this technology is will be presented today, and most of them are are researched and developed at my institute, and some of them are from our partner university as well. So I'm gonna walking you through of this technology. So I would like to divide into three groups. So the first one is logistics and management in hospital. So these topics, this group of technology, I will tell you when the hospitals in the normal situations. I think the hospitals still in Thailand. I'm pretty sure it's in most of Asian countries. It's very hectic, and there's a lot of nurse, doctors working. A lot of happen. And for sure, the logistics management going to be one of the critical problems that going to solve and organize this as well. So for the first one, I think it's not just only for normal situations, but especially in the COVID situations. People need more social distancing and need more times to, let's say, the nurse and doctors need more time to pay attention to the patients. So that's why the logistics should be done automatically with autonomous mobile robots and another autonomous systems. And the second one is a group of assistive technology and treatment and preventions. So this one, I'm going to introduce some technology that is the technology that's used for monitoring the patients from distance away. Let's say it's IoT systems that can monitor the patients instead of having caregivers that be there all the time. And for sure, just in COVID-19, the caregiver want to let's say stay away from the COVID infections as well. So if we can do the caregiving activities remotely or do monitoring, so it will be great. And also something about telemedicine robots, that this one is very hot issue right now. That previously the telemedicine robotics already developed for more than 10 years, I think. But right now, I think when the COVID-19 pandemics come, it's the right time that we want to promote the social distancing, and also we want to keep the doctors and nurses away from the patients. That is how the robot can himself. Okay, so that's why the telemedicine is going to be one of the critical systems that we use very very much in COVID-19 treatments. And last one is about diagnostics systems. So we have the zero core healthcare applications. So I will show you some of the AI technology that help for analyze and diagnostics the X-ray films and a lot of things in not just only in medical applications but in biological application as well. So let's walk through this with me. So firstly, this is the cover is logistics management systems. So this system is actually the system is actually developed around a year ago before COVID's coming. So this one is actually the AMR or autonomous mobile robots that can walk through the space. So previously, started using this one within the factory, and right now, when the COVID's come, we apply this technology with to be used in the hospitals. So in this case, we can equip the cover or this AMR with many applications. For example, use the cover cap for deliver the drugs and food and many things to the patients in the negative pressure rooms where no one's gonna be getting. And the next one is we apply the cover with the UVC lamp. So this one is used for infections, and also we we also design, cover, and apply with the negative pressure rooms. That this one is high mobility. So the negative pressure room gonna put over here, and the patient's gonna put in here, so we can transport it safely. So all of these are the applications that we can use with AMR. And right now, I would say the COVID-19 is remain stable somehow in Thailand. And right now we actually continue to develop this one for hospital transportations in other areas. And this one I think is quite common in European countries and US. And but in Thailand and other Asian countries is still something very new, and we need a lot of works to make sure that's customized but perfectly for Thai environment. Okay, and next one is automatic dispenser systems. So this one we use with pharmaceutical department, and for sure, when COVID-19 is coming, and for sure, we try to do social distancing, and we try to minimize the densities of the staff in any rooms in hospitals. So in here, instead of having a pharmacist to do all the job, we try to do everything automate. And this one, we still have a lot of problem with this. Technology wise, it's all right, but when we implement it with the real hospitals, there's a lot of resistance, and there's a lot of technicals and a lot of standards involved. So in this area, we need to get very close to the HA standards or other hospital standards, and all of this we already done and implement in some of hospitals in Thailand. And also, actually, I'm from university, which is education sector, but we also have collaborations with industry, and this one we develop and we research and develop in our universities, our labs, and then we have the industrial partner to commercialize this one. And right now, this kind of machines has been implemented and deployed in a lot of hospitals around Thailand.
Excuse me, Dr. Supahad, just a reminder that we have 4 minutes left. So for you to craft your presentation knowing that you have 4 minutes left.
Sure. All right. And next one, this one is on best movement or NEF. So this is quite important that the caregiver can see the patients when they are on bed. Okay, so just for normal situations, the doctors and the nurse want to prevent the bed sore and a lot of symptoms that we can on the patients on bed, and this help a lot because this is IoT systems that for example in one COVID ward we placed this sensor mat to every patient's bed, and we can monitor the posture of the patients to make sure that they lie on the bed in the correct way and not falling down. So I think this got potential, not just only COVID-19, but for serving our aging society right now. Okay, and about telemedicine, we also develop a lot of robot as well. For example, this one called Sofa is from Fibo, and this one, as I say, we try to do social distancing between nurse and doctors. So this one, the nurse and doctors can be outside the negative pressure rooms, and we send in all of these robots. And so this robot equipped with a lot of sensors, cameras, and a lot of things that can do screenings and can do diagnostics, and the doctor can see from distance. So this one we use in a lot of hospitals around Thailand as well. And also this from another company is partnered with Stanford University. This is very, very impressive because this is telemedicine or robot as well, but they can implement and do their production for more than thousands sets and send to, because this one is low cost and simple and very, very good. So they already implement in more than 50 hospitals in Thailand for helping COVID fighting. Oh, this one. Okay, and come to the last one, last section.
Yes.
This is the application for healthcare. So we talked about AI, we talked about artificial intelligence, deep learnings, and a lot of things. So we can use AI and implement for diagnostic a lot of things. For example, this project from CL Core from KMITL. So they can use AI to detect a lot of things. For example, this one using AI to detect malaria parasite, and this one for classify the leukemia. So this one will be used for medical applications very, very effectively. And last but not least, this one, the AI again, this one from Inspectra. This is co-developed with Fivo as well. And this Inspectra AI radiologist can take the X-ray films and diagnose all the symptoms. So normally for top 10 lung disease in Thailand, so we achieve something like more than 85% of 85% accuracy. So this one helped a lot. And also in COVID-19, we collaborate with our 10 hospitals, and we got a lot of cases from France, from Germany, and a lot of countries in Europe. And we train the models of this AI, and we can detect something like more than 80% of COVID disease at that time. And so I think all this is very, very important for the future. That's all of my presentation. Thank you very much.
Thank you very much. Kapkun Kapmak, Terima kasih. Thank you so much for this presentation. I've been asked by the organizers to accelerate this a little bit because we want to keep with our schedule. So please allow me to summarize this really quickly, that we started with the voice of Alina, citizen empowerment. We heard the story of how citizens really went after the data in order to solve this problem. Then we next went to a government response where we heard from Dr. Very, all of the different things that the city of Jakarta is doing. And what I want to share really quickly is that Dr. Very shared with me something he's very proud about, that Jakarta initiated preemptively a science-based response upon when they learned about the event, COVID, in January 2020, they acted immediately and took the lessons from the public. Lastly, we follow up with Dr. Supachai, who is showing us things that we can do with this data in the region, with the industrial research and production capabilities we have in the region to solve these problems. And I thank you very much for your time. I believe that we are going to show a 10-minute video now. Mira, do I understand that correctly? And I'm handing it over to you. Thank you very much, team, for a wonderful presentation and session.
Thank you so much, Mike, and also to all the speakers. It has been a very interesting session. Obviously, we would need more time to elaborate on this, so to see much more. So thank you also for Mike for the moderation. And yeah, we're going to show you now as a closing to the session a video on the on Bangkok offices on Smart City. So enjoy the video.
ปัญหามากมายรอบตัวเราได้สะสมกันมาอย่างยาวนานจากความไม่สมดุลของการพัฒนาและมีแนวโน้มที่จะทวีความรุนแรงมากยิ่งขึ้นไม่มีใครอยากให้เป็นแบบนี้แล้วสาเหตุที่แท้จริงคืออะไรแล้วใครล่ะที่จะมาแก้ปัญหาเหล่านี้ทำทันที now มาเริ่มกันเลย
นำคนต่างๆได้มาร่วมกันจากหน่วยงานต่างๆทั้งหน่วยราชการเอกชนภาคประชาชนเขตพญาไทตำรวจทุกคนก็มาร่วมกันคิดที่จะมองว่าและใน20ปีข้างหน้าเนี่ยคนไทยจะเป็นยังไงบ้านเมืองเราจะเป็นยังไง
ถึงเวลาที่ทุกคนจะถอดหมวกของตัวเองและมาร่วมเป็นส่วนหนึ่งในการเปลี่ยนแปลงประเทศนี้อย่างยั่งยืนเราเชื่อว่าเพราะพลังงาน คือปัจจัยสำคัญในการพัฒนาประเทศจำเป็นอย่างยิ่งที่ต้องเร่งสร้างความตระหนักในการใช้พลังงานอย่างคุ้มค่า
เริ่มจากจุดเล็กๆนะครับในพื้นที่เขตพญาไทก่อนเริ่มผลักดันให้เกิดการใช้และเปลี่ยนรถตุ๊กไฟฟ้าจากที่เป็นทั้งน้ำมันและแก๊สเนี่ยมาเป็นรถไฟฟ้าทั้งหมดภายในระยะเวลาใกล้นี้ครับ
เรื่องเสียงแล้วก็เรื่องอากาศนะครับแล้วก็ที่สำคัญก็คือเป็นการประหยัดน้ำมัน
ลดการปล่อยก๊าซเรือนกระจกเพื่อเพิ่มออกซิเจนลดพลังงานที่ไม่จำเป็นเพื่อสำรองพลังงานให้กับเมืองพญาไทจะเป็นเมืองที่เข้าใจในการใช้พลังงานอย่างยั่งยืนอย่างแท้จริง
หลายๆคนเนี่ยมองว่ามันเป็นไปไม่ได้พวกเราทุกคนเนี่ยมั่นใจว่าสิ่งที่เป็นปัญหาอยู่รอบตัวเราเนี่ยถ้าคนไทยทุกคนเนี่ยได้มาถอดหมวกแล้วก็ร่วมกันแก้นะฮะแล้วก็มองไปข้างหน้าเนี่ยทุกอย่างย่อมจะดีขึ้น
Smart City ไม่ใช่แค่เมืองที่มีความทันสมัยเพียงอย่างเดียวแต่คือเมืองที่ทำให้ประชาชนทุกคนได้เข้าถึงบริการสาธารณะอย่างครบถ้วนได้มีชีวิตความเป็นอยู่ที่ดีขึ้นพึ่งพาตัวเองได้ที่สำคัญจะต้องทำให้จริยธรรมความดีในตัวทุกคนได้ออกมาใช้เพื่อสังคมที่น่าอยู่ยิ่งขึ้น
มั่นใจ 100% ว่ามันต้องเปลี่ยนแปลงได้เพียงแต่ว่าเราจะทำหรือเปล่า
มันลงมือทำเพราะไม่งั้นเนี่ยมันก็ได้แต่คิดฝันกันในกระดาษ
ผมตัดสินใจเข้าร่วมด้วยนะครับด้วยคำตอบเดียวคือผมต้องการให้งานนี้มันสำเร็จ
สู่สังคมที่มีเวลามากขึ้นสังคมที่มีสมดุลมากขึ้น
โครงการไม่ว่าจะใหญ่หรือเล็กเราคงต้องมองถึงความคุ้มทุนมันไม่ใช่ผลตอบแทนทางการเงินอย่างเดียวเรามองถึงความสุข
พญาไท 4.0 จะทำให้คนกว่า 600,000 คนซึ่งแต่ละคนล้วนมีความรู้ความสามารถและประสบการณ์ที่ต่างกันได้ใช้ชีวิตได้มีโอกาสเรียนรู้ได้ทำหน้าที่ของตัวเองอย่างสมบูรณ์ทุกคนล้วนเป็นกำลังสำคัญที่จะร่วมกันพัฒนาประเทศไทยให้เจริญรุ่งหน้าได้อย่างรวดเร็วมั่นคงและยั่งยืนพญาไท 4.0
ดีมากๆขอบคุณครับมากขอบคุณครับมาก wonderful video thank you so much
So thank you again for this incredible session, and I hope that everyone here and also the participants will be having the opportunity to talk a little bit more with the speakers or with the moderator in the upcoming session. So thank you so much for all the speakers, and see you soon.
Thank you.
Terima kasih.
Thank you.
Kapungka.
Thank you, Mr. Mira.
See you in the lounge.